Thank you and welcome. And this is the meeting of the Government Accountability Committee at 10:05 on Thursday, August 26th. And we have all of our committee members present, 7 in person and 1 who has Zoomed in. And also with us today, Justin Kenny. And I believe Susanna is also, Susanna Davis is on Zoom. And I think that covers, we did not, unfortunately, connect up with Drew Resley. She was unable to attend, but she is, I'm sure, going to be aware of what we're talking about today. So if everybody has the agenda, by the way, I'll just mention again, as I did when we started last time, the microphones in this room are very sensitive and will pick up even papers rattling. So just to be aware of that. And they're on, so please be aware of that. If you want to not have them on, that little circle, if you tap that, the mics go off.
Did we, I didn't print off the indicators that we're looking at. Do we have copies, paper copies of them here?
I don't know about that.
I do not. Is this something that's on the committee's website?
It's these, and
It was an email that was sent from Justin.
well, you sent it too.
Is that one from you, Representative Brumsted?
Yeah, I think.
I'll go print some up.
You want to just use this?
No, I can print them and go.
Thank you.
Okay.
How many people would the whole table?
I printed them out at
I
home.
have them too.
I did.
I mean,
That's
Why
okay.
not make enough for the whole table? That would work.
I just sent it, Brandon.
So just again, the microphone's live, just so you know. This is also going to be broadcast, if that's the right term, on YouTube and recorded for people that can watch it later. If you make sure that you mute your phones, that would be appreciated. Just put them on so they can go ahead and go off, but as long as they're not making a noise, it's probably okay. So first item on the agenda is dashboard training and the scheduling of it. And Justin Kenny, who's the interim CPO, is with us again. This is something that we talked about last time, and he promised to have a little bit more information about, especially people coming into the legislature for the first time. As we saw with, I think, at least one of our members, this was the first time that Representative LaFave has actually been in the building. So I had to show her what the cafeteria was. So there are situations where people coming in as new legislators would have no idea what this committee is doing or how to get to the dashboard, et cetera. So it's important that obviously we train people, and Justin, I know you have some information for us.
Yeah, so last time I had mentioned that I sent out a memo asking for folks to update the data. That should be done by September 10th, and then it will take me maybe a week or 2 to actually get the data into the dashboard so we can actually submit the report. The dashboard itself, folks that have been there, it's the Agency of Human Services dashboard, Clear Impact Scorecard. So there's a special dashboard that's set up for the outcomes report. It's basically like a filter on all of the other data that's there. And so there's a link that we usually send as part of our report to that. I think in general, it's hard to find where that data lives. The link is accessible. It's usually on the Agency of Administration page, but if nobody goes there or somebody doesn't get it in an email, they're not like just going to stumble upon this. So I guess the question would be for you, what would be the best way to make sure that the legislature gets the information about it, is aware about it, knows what's in there, and how would we increase utilization? Because I think that's one of the things that we'd like to do. For the data is there, it's available, we've got trend lines, we want people to be looking at it. What's the best mechanism?
Well, I would hazard a recommendation that we work through leadership on both sides. It has a tendency to be a little bit more looked at, if you will, if it comes directly from either the pro tem on the Senate side or the speaker on the House side. I think if they send the message out to their members, it would resonate a little bit more strikingly than if you just sent it out and said, right away, here it is.
Yeah.
That, if anybody else has, yes, Representative Dolan.
Yes, I think I was remembering from the last conversation we had that there was a potential to tie this out with the release of the updated report with the training of how to better use data in legislative decision-making. And so I don't know if that's a way to tie it together, be like, hey, here's the new report, and this is an opportunity to reflect on how we can use data.
Yeah, so I saw those as two different things. One is the training on data and what to look for in data, which you
Okay.
and I had talked about kind of collaborating on. And then the other is the dashboard. Here it is, here's how to use it. We
Okay,
can do both of those things. There's no problem there. I guess it's a matter of what would folks most consume? So is it going to be a PDF that goes out that's like, here's the dashboard, here's how to use it? Is it a video? Is it a live training that people sit in on that's done over Zoom or Teams? What makes the most sense?
Senator Persley.
I think I don't know if it's the best thing, so I don't know if it's
Sure.
answering that question, but to have it on this committee's website, because there isn't anything here. If the question is training people what the committee does, and once they learn that, then this might be a place for them to go to then either just a link to the dashboard or maybe an image of the dashboard, so they also know kind of what it is.
Okay,
I think that would be one thing we should do.
Does anyone else have suggestions? I do think in the world in which we live, video is not necessarily going to, I don't know if anybody that would actually sit down, and I don't know how long the video is, but let's say it's a half an hour and watching it. We're so videoed up, if you will.
yes.
To me, it would be better if it was either a PDF or, as Senator Porcher suggested, put it on the website and then they can click on it and find out. Did you new members get any sort of information on this when you first were sworn in and became members of the committee itself? No? Okay. That's why, again, I think if we work through our leadership positions in both chambers, it makes a little bit more sense. Yes, Representative May.
I agree. And I also think that a little workshop that would be included in that note from the speaker in the Senate Pro Tem, because there are people who really don't like just trying to figure it out on their own, like me. I'm not very good at technology. And so being in a room where someone would talk us through, there might only be 5 people that will show up, and that will tell us a lot as well. So I think that just having, a short half hour, we're going to show you how to use this. And if you have more questions, you can always reach out to us, but get you going kind of thing.
Okay.
Yes, Representative Thompson.
And a question for Representative Brumstead. In what time frame are you imagining the workshop?
I was thinking right when we are back in the building,
In January.
because then you could just do it, at the end of the day or early morning, and people could just come, but it would have to be quick because then we all get inundated with
Yeah, we
work.
sure do.
But we have time to do that, I think. It's only August, almost September.
Yeah.
Excellent. Okay,
And your report, Justin, is out September 30th, if I'm remembering correctly?
that's the due date. Yep.
Okay. So to Representative Dolan's point, it would be probably a good idea to put them both together. I think anyway, here's the report, and by the way, here's how you can get to the dashboard, and this is what it's for, kind of thing. Yes.
and I'm wondering, I agree that it could be convenient to do it when we're back in person right after, and I feel like that's a kind of long time if it's released September 30th and we're not back till January. So I mean, I think a Zoom meeting could be a possibility. Maybe it's options of like here's the release of it. It's on our committee page. Like that's for the person that just wants the info. And there's a Zoom option before we are back in person. And then maybe it's, hey, here it is again in case. So it could be those options of it. A question I also have is there usually a press release that goes out with this, or I just feel like if this is saying this is the indicators of the well-being of Vermonters, like that, I feel like draws attention to it. Like we should be looking at this and saying something about it. So does that happen? What's
I'd have to look back and see. To my knowledge, no, but I could be wrong on that.
okay?
Because I think you're right. More and more people, I don't know about other members here, but more and more people are reaching out to me, wondering about government accountability because so much is going on and you hear so much about. So I think that this shows how we are accountable. We're measuring the work, or we're looking at what's going on throughout Vermont and how they're accessing.
And I think it's putting it on us as legislators to, we have this data, now what are we going to do with it? How do we interpret it? How do we see what next steps need to happen? This seems like a real opportunity.
Excellent. Okay.
Anything else for Justin right now? I know he'll have a small piece in our next section too.
And I-
Do you want to touch on the data training and when that might happen and what that might look like as well?
Yes, please.
So I had sent out the list of trainings that we're providing to state employees. If anyone wants to take any of those, let me know. I know one person did. And then how would we provide a training to the legislature around data? What might that look like?
Could it be tied to the outcomes of like looking at this data, the outcomes report? How could, like, posing those questions and have people think through whatever the process is in your training? How do you, like, I feel like that's would be hugely useful and applicable.
That one you might want to do the week before we're in. Well, that's a hard week. It's New Year's. But I was just thinking that you have to spend a little more time with to wrap your head around it. So
Mhm.
it's harder to do that when we're also working all day. And then, but the beginning couple of weeks are pretty, you have extra time, it seems like, especially if you're a new member, and you would have, the new members, I think, would be very interested in this. I don't know, you guys, that was just my initial.
Yes. The interval between, let's say, October, November, and December seems to be, there's a long space of time after the report is out. So if you're asking about whether we've already reconvened or whether we're not in session yet,
Yeah.
we probably have to think about that. If we're not in session, I guess a Zoom meeting is probably the easiest to affect.
And-
Yes, I just noticed that too. Thank you. Drew, you had a question?
Yeah, I just wanted to jump in. Hello, everyone. Good morning. It might be worth considering, and I don't know the timeline for this, but we've had a difficult time in the past trying to schedule trainings and workshops in like the opening month of the session. And I think to Justin's point about what format is going to be most consumable for people, it might be worth opening this up to legislative leadership and finding out if they want to explore a more sustainable solution over time for the data training, like integrating it into new legislator orientation, as opposed to just offering a one-off. I think the data workshop that we had last year or 2 years ago, was really successful. And I honestly can't even remember what time of year we were able to make that happen. So I just wanted to acknowledge that maybe if we think about this as a longer term opportunity rather than just a one-off, we may find more opportunities to get more folks actually who can participate. It just gets so busy so quickly every year that I feel like we typically get a little bit steamrolled.
Representative Townsend?
Perhaps to work off of Drew's suggestion, perhaps we could do something in the near term, and at the same time be working with our respective leadership in the legislature to fold things in for when we have, once again, a brand newly elected legislature. Because otherwise we'd be waiting a whole year, and folks who were elected a year ago would not have access to the information. Anyway.
Yeah.
My suggestion is that maybe we look at doing both.
Okay.
And that meeting, Drew, I think was November. It was, and you're right, we got great participation. So maybe even a Zoom meeting would get good participation in November.
That's the one we had over at the pavilion.
Yeah. I remember because it was cold and we had to bring everything in.
Okay. Anything else?
A question, what is our role in helping with the training? Is it just helping getting word out? Do we help? Like, I just want to be supportive of it. I'm gung ho for it. I would like to do the training, take the training myself. So I don't know if we usually provide assistance to that.
Yeah, I think obviously helping with scheduling and making sure we're figuring out the best time to do it. Most of the content itself will be me, and I'll pull in Drew to help with components that are in her wheelhouse.
Okay.
I think it's just getting the word out there.
Okay.
Make sure we get the right time of year.
If you could stay in touch with Representative Townsend and myself, we can
We'll do it.
funnel it to the committee and probably talk to the pro tem and the speaker as well.
Yeah, and my impression is that we'd want in that training to actually get people's hands on some data.
Mhm.
So it's not just going to be content theory. It would be like, take a look at this trend line, take a look at these data points. Like, what questions do you have?
Yeah.
What would you want to know more about? All that. So really hands on.
And also, I think a little time on when you are looking at legislation in your committee room,
Mhm.
talking with folks like you and Drew about what's possible to be able to collect, because some things are just too expensive to collect or
Yeah.
too unwieldy to be able to collect. So I think a little bit about that is important,
Mhm.
because I know that was a hard lesson for me. I wanted to just collect.
You want
Why
every-
can't
you want
we collect
everything, yeah.
that? Yeah, exactly. So
Yes.
And as I recall, a key piece that made it extra valuable for the folks who attended at our previous workshop was that there were the hands-on activities were actually applicable to, so how am I really supposed to use this? It wasn't theoretical at all. We had sort of like role playing. Here's a sample. You've got this pretend activity.
Mhm.
And it was worked through, and it was really very helpful. I just noticed Senator Rom has a question. Or,
Yeah, Senator Hinsdale.
oh, excuse me, sorry.
Thank you. So I just don't want us to forget that we have a lot of task forces underway right now that are supposed to be looking at big picture issues. And many of them are a little bit devoid of centralized or shared sense of what data we should be looking at. I'm on the Accessible Affordable Healthcare Task Force, and I've been asking for data since the first minute of the task force. We have task forces on education, unemployment, and a number of key issues for which we want to be able to measure toward our outcomes. And I hope either in our role or, somehow in a more systematic way through Legislative Council, we can get those task forces to think about how the data they are looking for aligns with the data that we hope to be measuring every year.
Okay, good point. I remember also when we did meet, and we called it a workshop, I guess, the speaker showed up. She was there that day and lent that sort of added support to our activity. So,
And it wasn't just a drop-in,
no,
spent time
she did.
Yeah.
It was very welcome.
and participated.
Yep.
Yeah.
Okay. The next item on the agenda is the GPI. We talked last time about the fact that it sort of stalled. And it would cost some money and some human resources to kick this back in. So Representative Townsend went and sent out an email to the committee chairs and asked for feedback as to whether they were using this or not. And also, I know Justin talked with JFO and also the Gund Institute about what in fact it would cost. So I don't know who wants to start, but,
And I just wanted to say that I also had the feedback from JFO
okay,
with regard to use.
Yeah.
Utility thereof.
so why don't we start with Justin?
I can go because mine's brief.
Sure.
The UVM has been unresponsive to me so far. So I have no additional data to share.
That is very brief.
But I will reach back out to them and see if I can get a status update on it. Yeah.
Okay,
But same as last time, I had talked to Kenneth Jones at Agency of Commerce Community Development about updating the number. Again, he said it would probably take him 15 to 20 hours just to get a new number.
Mhm.
But it's really that report, the analysis behind the numbers, what it all means. That's the piece that UVM probably need to do.
Okay. So what did we find out from our survey?
Well, the result, I did an overview of the results of the survey, which were sent out to everyone, yes?
Mhm.
Everyone had an attachment. So it speaks for itself. Of those who responded, the overwhelming majority said they did not use the GPI. Some folks were confused as to what the GPI was as opposed to RBI, results-based accountability, RBA, results-based accountability issues. And so I helped sort that out, and then they came back and said, no, we haven't used that for ages, the GPI. But we're focused on RBA, results-based accountability. Some of the chairs responded, as you saw in the overview, with thoughts beyond the yes or no as to whether or not they use it or thought it useful if we did have it to use, and gave some real thoughts as to how we might best use such information were it to be available.
And JFOs?
Oh, JFO, also, I did include that, did I not, in the overview? Yes, that it's not useful for them in the context of the time frame within which we need to do our work.
Yeah, Senator White.
It is unfortunate, and I don't know that it's something that necessarily we would use in our work, and legislature in general, different committees may not, but it is such a much better indicator of the well-being of our society than the gross national product, which is what we use. And this is just such a much better indicator. It's too bad that we can't just get the federal government to switch and use it instead of the gross national product, because it does tell us the direction we're going in a much better way. But I understand that for us, just as a state, to be using it, I think there are only a couple states that actually use it. Is Maryland, I think, is, I can't remember which the two states were that, yeah, but it's too bad.
So at this point, I don't really think that we need to proceed any further. If the great majority of committees aren't using it, and even JFO called it not a useful tool, it doesn't appear that it would be a good decision to spend any money researching and getting new information. Just my feeling.
And if I could add to that, we're somewhat hamstrung in terms of absence of information. If UVM, personnel at UVM, having had responsibility for putting together the index and analysis and all of that piece, if we're still sitting in the dark as to what that would all involve, both in terms of human resources as well as financial resources, we're in no position to be making, I would suggest no position to be making any decision to move forward with GPI at this point in time, for sure.
Yep. Any other comments on that?
I guess I feel like I don't have enough information on it. So hearing from Senator White of how useful it is, like, oh, that's interesting. So I'm just wondering if it's something to put on the parking lot as a potential training opportunity for us as a committee to, if UVM gets back to you, to hear and learn more about the tool and the potential uses for it, or how it could move forward, to not lose it. Because I think sometimes too, it might be that committees aren't using it if they don't fully understand it, or it's not very accessible, or I think it was from 2018 is the last data. So there's that piece, right? Of course, you're not going to use data that isn't current, but if we did have the momentum for it. So it's something for us to keep in the back of our heads, I guess.
Okay.
And the statute, if I may, and the statute which addressed the GPI was a while back, so that many, many people who are currently in the building and legislative positions have never even heard of the GPI in the context of the original discussions, which went into the preparation and enactment of that particular statutory language.
So one thing we could do is take a look at the indicators and the measures within the GPI deep into the calculation and compare those to the current indicators that we're tracking related to the outcomes report and see if there's anything missing. So if there's things in the GPI that make up the calculation that you want that are not in the current outcomes report, potentially we could add some of those as indicators. I can do that analysis to take a
I
look.
was just going to ask if you would be willing to.
Okay, I figured that. Well, I shouldn't say anything because then it's more work, but I'll do it.
Very helpful.
Yeah, okay.
Okay.
See, this is why he's sitting in that interim position.
Mhm.
Looks at these things.
The next item, and this was, we're happy that Drew is with us because at one point I didn't think she was going to be able to join us. We talked the last time about the Act 166 situation and potential overlap between a couple of things. And Drew, we did all, I think, get your email. And you do reference it in the 6th paragraph. CDC and CRF funding are supporting the continued development of the AHS community profiles of well-being through an equity lens, which will conduct statewide community and stakeholder engagement. So we were curious whether there was any sort of duplicity with respect to those two funding sources. And if you just want to go over again, the situation there, that would be great.
Great.
Some of us weren't
Happy
here
to.
last time.
And I'm grateful that Susanna Davis is also here on the call. I know that she can't be here for the whole meeting, and I'm actually going to have to leave at 11 and can come back at 12. But so I think in short, Act 166 asked us to take a hard look at Act 186, which is the outcomes report, using an equity lens. Act 186 is only so meaningful towards equitable outcomes as it actually sheds some light and illuminates disparities in outcomes according to different categories like race, gender, age, ability, socioeconomic status. And right now, Act 186 is limited in that it does not explicitly disaggregate any data by those categories. And Act 186 also was not developed explicitly through an equity lens. And so there may be whole indicators that would help us better understand disparities in outcomes or disproportionate impact of our service systems on people, for instance, by race that have not been included. And so Act 166 gave us the opportunity to revisit Act 186 using an equity lens. As some of you will remember for having been involved, a small working group was tasked during 2020 to essentially try to do that, revisit Act 186 using an equity lens and trying to engage additional stakeholders. And we started by leveraging a list of indicators that Susanna had pulled together out of, I believe, and she can speak to this, different stakeholder input that might have come in an ad hoc way or that came as a result of a request for recommendations. We had very poor participation in the couple of opportunities that we created for stakeholder engagement. And in part, I think we have to attribute that to the pandemic. I'm also not sure that the public is as well versed in the opportunity that Act 186 really is to set a data-driven agenda for the state as they could be. And so there may not have been, we didn't see people jumping at the opportunity to participate, where I think with a little bit better marketing in advance, we might have seen that. And so what we ended up feeling left with was a pretty inadequate list of recommendations, inadequate in that it wasn't fully vetted by major public partners and stakeholders in equity work across Vermont, and also just members of communities across Vermont. And so that's kind of the picture as I see it in relation to where we stand with Act 166 and Act 186 right now, is really needing to fulfill an opportunity to create, to facilitate stakeholder participation, community participation in defining what Act 186 is. And I'll take this opportunity because I did have a conversation offline, off our thread with Senator White about this. Act 186 is not an administrative report. If you want administrative reports, Justin and I could fill the room with those about performance data. Act 186 is, you can think about as being owned by the people. It is about our collective well-being as a state. So remove your hat as a legislator, I remove my hat as a state employee. The indicators in Act 186 should speak to what I believe is possible to achieve in well-being in the state of Vermont. And so it can easily be co-opted, just to use that word honestly, by state administrators who have an idea of what well-being is, but that might frankly be different than what community members across the state believe is important. And so I think your opportunity in the legislature is to really open up opportunity for the people to come in and say, this is what I believe well-being looks like in my community, and this is how I wish we could be able to measure it. And for then state administrators and subject matter experts to say, these are the data sources that we believe are high quality that can help get at that intention. So there's a little bit of a negotiation that happens there. But if we don't have public participation, it's really just the state saying, this is what we think is important and this is what we have available, which is missing, I think, some of the heart of what Act 186 is. So usher in CDC, a quite enormous amount of CDC money that I know you've all heard of before, to help us respond to the equity issues that surfaced during the pandemic. So it is a CDC health equity grant that is funding a number of different projects, including many direct community grants, but also some health and public health infrastructure, including data dashboards. How are we increasing access to data that illuminates health disparities in the state related to the pandemic, but also beyond, so that we can address the roots of inequity? And the community profiles is one such project that is getting a little bit of support through that funding stream. The community profiles is different than the Act 186 report in that it's taking statewide population indicators about well-being across the health and human services continuum or spectrum and disaggregating it by county, AHS district, and hospital service area, which makes it a very useful tool for local planning or regional planning. Whereas Act 186 doesn't do that. Act 186 stays at the whole statewide level. And so the community profiles, should it be revisited through an equity lens, I think would really support our belief that if communities have better access to data, they can act on it. And if communities have better access to data about inequities in outcomes and disproportionate impact of systems, they can respond to that through an equity lens. So Susanna received money through, or her office received money through CRF to develop an equity dashboard. And we put our heads together and realized that we were essentially going to be developing the same thing. And so we made the decision a couple of weeks ago that we would leverage CRF dollars into the community profiles project. And what that will look like is contracting for an external facilitator that can facilitate robust stakeholder engagement across the state of Vermont, much like we did when we first developed the community profiles or redeveloped the community profiles in 2018, but through an explicit equity lens. And so that would look like stakeholder workshops across the state, which you would be invited to as legislators to participate in, to reestablish what recommendations would be for understanding and measuring well-being, especially through an equity lens. The second component of what the dollars would be funding is a migration of all of that data and trend lines that we're currently reporting through the profiles and that we would be editing through this stakeholder engagement process into a different and much more user-friendly interface, a data dashboard tool that the state already owns, which is Power BI. So currently we are using a tool called Instant Atlas. And for those of you who have spent time in the community profiles, it's kind of bulky and can be really hard to use. And we have the opportunity to use a better tool that the state already owns. And that in part is what the money we have for the community profiles will fund as well. So the case I'm making to all of you is that the Government Accountability Committee may not need to develop its own community stakeholder engagement process and try to manage it out of the State House. if you feel comfortable and confident, essentially sponsoring the community profiles effort as a way to surface new recommendations that could be leveraged by Act 186. What I personally would recommend, if you're interested in this approach, is basically just hosting a series of either public hearings or just inviting testimony after those recommendations have been generated for people to respond to. So a similar process to what, frankly, we tried to do in 2020, but having already had several months worth of stakeholder engagement across the state to get people involved. So hopefully that was not way too verbose or dense and made sense, but I'm interested in your questions that might help clarify.
You were neither.
Okay, good.
Does anyone have a question or comment?
So,
Yes, Representative Thompson.
Just to ask, to make sure that I'm understanding correctly. So what you're putting on the table, as it were, is that through the work that would be being done for outreach to stakeholders through the contracted service, that what comes back from that effort, we would then hold one or more public hearing type things to get people's reactions to whatever has come in through the contracted effort?
Thank you for that question. Let me take the opportunity to clarify. So when we relaunched the community profiles, and I think it was 2018, maybe it was 2017, honestly cannot remember. We hosted stakeholder engagement events across the state and had, I think, something like more than 600 indicators recommended for us to review. We had an internal process, which was very comprehensive, to essentially digest all of those recommendations. We organized them, we categorized them, we looked for the real intent of each of the indicators that have been recommended, and then we assessed them in relation to all the known data sources that we had access to, which frankly, I think we have access to perhaps more now than we did then in terms of our relationships with other state agencies that could participate. That being said, out of all of that, we were able to distill the list into something that felt very comprehensive and would fulfill 3 different profiles. So basically, 3 different reports, if you will, with different data sets in each of them. And that we felt satisfied the community. What we heard from communities were the really desirable indicators. So what I would recommend in this case is that a similar process will happen of having a ton of recommendations come in, an internal process to categorize and try to distill. And then what I would recommend is that we bring that list, the Agency of Human Services, bring that list to this committee and say, we believe that these indicators more effectively reflect our belief in the possibility for equitable outcomes and the data that will help us get there. And relative to the Health and Human Services filter on all of these indicators, we would recommend you consider these, at which point you could host a public hearing or just invite testimony about the recommendations that we've put forward. And additional vetting could happen there. So that would be the opportunity if something didn't make it into the community profiles, for instance, for a stakeholder group to say, we would really advocate that this be part of the statewide report, even if not part of the community profiles. Big caveat here that I'm kind of winking at Justin around is that our efforts are meant to be comprehensive about well-being, but may skew towards the Health and Human Services sector, given that that is the scope of our programmatic work and our ability to contribute through our strategies is there. And so there may be, what might be missing are certain indicators around like perhaps the natural environment or like the agricultural economy or the economy more broadly than we access it through the Health and Human Services system. And so what it will not deliver to you is a new list of Act 186 indicators that you could adopt whole scale. It would be a highly vetted and community informed list of indicators that you would consider for inclusion in Act 186. But you may need to hear from the public beyond that. What are the implications for equity when we look at our outcomes related to agriculture or the economy in general, or our state infrastructure? Those might be outside the bounds of our work.
I see Senator Hinsdale's hand is up for a question, but I just wanted to thank you, Drew, because that was one of my first, and I want to say concerns, but is the intersection between what this group does and what AHS was doing already. And I didn't want to make sure, or I wanted to make sure that we weren't doing the same thing twice, but you very well answered that, and I appreciate that.
Yeah.
Senator Hinsdale.
This might be partially a comment and a question, trying to remember some context and where we landed. But I recall in one of the small meetings that I was in, and again, I feel like I was very confused as a recently appointed member of that committee and co-chair of the Social Equity Caucus. The invitation came late and it wasn't clear if it was just supposed to be legislators or not. So, we really, really need a public process to truly be a government accountability committee that's accountable to the people. That all said, I'll get off my soapbox. There was an effort to combine outcomes around housing that's dignified in settings that people prefer. And there were two different ones related to seniors and people with disabilities. And deeper than my concern about combining those without a lot of public input was a concern that they had very few indicators. And I just raised the deep concern and alarm that we would have so few indicators around housing, which is such a critical issue. And I think since that meeting, it's only become a more critical issue. And, Drew, I know you were saying this is leaning more towards, human services. I just feel like that needs to be said, that I don't think we can sort of just in a cavalier way combine outcomes. And I really feel strongly about what Drew said, that we might, as state administrators, just be leaning towards what we think we can change or we can administer. But I was very concerned that housing had, I think, one or two very poor indicators underneath it. And I hope that we really work to address that. I think a lot of our colleagues are counting on us to focus on housing.
Thank you,
Okay,
Senator.
thank you.
If I could quickly
Sure.
respond to that,
Sure.
I think your point, really emphasizes something that I'd like to echo, which is what I'm presenting around the opportunity for the community profile stakeholder engagement work really is about revisiting indicators. That work is always done in the context of outcomes. So it's not just what do we think is important to measure, but what are we trying to accomplish? What do we believe is possible in our state to achieve? Like, what are our highest aspirations for well-being? And from there, how might we experience this and how might we actually measure this? And that's where the indicators derive, from where they derive. I think the government accountability, and so all of that, I think, kind of stands alone and will offer up material that the Government Accountability Committee can review and consider. I think that an essential point here is that Act 186 does stand alone as a statewide agenda for improving well-being across the state. And you have the purview as legislators over how we define those outcomes. The indicators, as you all know, are a little bit easier to change around year to year because we made that possible in the statute. But outcomes need statutory change in order to change. And I think Senator Senator Rahm, I'm sorry if I got your last name wrong there, but
No, that was right.
Good. Okay. I think that we should not endeavor to change outcomes without a public process that we feel very confident in. And I think that's especially because they require statutory change. A little bit of history for folks in the room who weren't there at the beginning of Act 186 work. our goal was to make something that was comprehensive, but also digestible. So not to have 100 indicators, but to have something more like 20. And not to have 1,000 outcomes, but really to have something more like 10. And to use that as an opportunity to be high level and create common ground. I think that that's still the right approach, but I think that we need to be a little bit disciplined around the way that we use outcomes and the way that we use indicators and what we see as options for digging deeper. So if we decide that there's one indicator about housing that we can include in a report that only has 20 indicators, what are we doing supplementally to dig deeper into the data that we have around housing? Is there a separate housing dashboard that is invited, that creates the opportunity for legislators to dig deeper into that data? So there's always an opportunity to think about secondary levels of information that can help us better understand what's at the highest level. There was conversation in the session last year about changing outcomes by statute. So there was a couple of recommendations to improve outcomes that we just heard about, but there was also 2 more that were considered for combining. I can't remember if you named these, but basically elders live with dignity and in settings they prefer, and people with disabilities live with dignity and in settings they prefer. And each of those outcomes had just one indicator associated with them, which I think in and of itself speaks to the fact that they're not the most useful outcomes to include in a report. Just sort of disaggregating outcomes by population in that way is not always the best approach and tends to silo conversation rather than create an integrated, holistic conversation. So all of that, I think, really does require some facilitated process and a real invitation to the public to participate in. It's not easy to use the framework, even though the framework is pretty straightforward. So I feel like I've talked,
Representative Townsend.
I wanted to set the stage for that.
2 things.
Mhm.
First question for Drew. In the community profiles work, would we be expecting something to come back with regard to housing from that outreach to stakeholders?
Sure.
Yes, definitely. Yeah, absolutely. And
I
I
was
think
just
that
looking
even-
for confirmation of that.
yes, I mean, I think
Yeah.
it's very difficult for me to imagine that we wouldn't have lots of recommendations about housing indicators to consider. And the community profiles currently includes indicators about housing and would certainly continue to.
Great, thank you. And my second thing was just wanting to make sure that around the table here, that we understand that we as GAC do not have the capacity for changing the outcomes.
Right.
And the bill that would have been a genesis of discussion around the change of the 2 outcomes which Senator Collmore referenced, they're in Senate GovOps. It's in Senate GovOps, right?
Correct. It's on the wall as S95. And it was introduced by myself and Senator White. And it would, in essence, combine what is now outcome 7 and 8 into 1, thereby reducing the total number of outcomes to 9. And Drew read it and she was spot on. 7 right now says Vermont's elders live with dignity and in settings they prefer. We changed that to just Vermonters. And then 8 would disappear, which referenced the folks with disabilities, because it was the same sort of thing, but we just felt it was more inclusive if we didn't specify that you had to have a disability or that you were old, I guess.
And this is a perfect example of where I, as a state administrator and as someone who uses the framework, think that that's a really solid approach. I think that's a great approach, but it hasn't been vetted by stakeholders, advocates, and people with lived experience in Vermont. And so it would be hasty to proceed without having, really adequate public hearings about that.
Yeah, and as I recall, Senator White is here as chair of the Government Operations Committee in the Senate. We took it up very briefly. I don't know that we even took testimony at all, but we talked about the bill once or twice and then just put it back up on the wall. So it's still there and it's still alive in this second session or second year of the biennium. So at least we have a vehicle.
And as a follow-up directly to that, there are always any number of opportunities, given however a committee structures its work on any given piece of legislation, to hear from folks, as I say, in a multiplicity of ways through the legislative process. But I want to go back to, I forgot to ask Drew, again, with regard to the community profiles outreach, that component, what's the time frame that's envisioned for that?
Yes, thank you. So I don't have it right in front of me, so I'm going to go off the top of my head here, but I believe that our desired timeline is that we are issuing, I should probably just pull it up and not say anything incorrect, but our goal would be to begin with an RFI or an RFA, a request for, no, an RFI, request for information soon, like in September, initiate that, so that we could ideally develop a contract or establish a contract with a facilitator who can bring an equity lens to this work, and work with them over the winter to do planning around these stakeholder engagements and actually launch them in the spring. So maybe in March, wrapping up by June, which I think would give us the opportunity to have a sort of a list of newly surfaced indicator recommendations in probably July. So planning.
So in the
work-
interim,
Yeah.
I'm sorry, I didn't mean to jump in.
No, go ahead.
I'm just looking ahead. So in the interim, unless S95 moves anywhere, there will still be 10 outcomes. And assuming that your work isn't completed until, in essence, after the legislature has adjourned, there would still be the same indicators all next year as well. Is that correct?
Well, one answer is yes. Another answer is that we talk with Justin about what he believes is possible in terms of iterative changes to the indicators that we're putting forward in Act 186, starting with this first report. And out of a recent conversation, I don't want to speak for Justin, but it appears to me that the indicators that AHS puts forward to Act 186, there's probably maybe 3 out of 20 that we actually could disaggregate by race and ethnicity for this upcoming report, which has not been necessarily stated as an expectation, but is a possibility. So I think one option is that we continue to have the conversation as however GAC or the government operations committees can, inviting people to participate and hosting the conversation to keep this on people's radar and to invite discussion about indicators, perhaps without intention to change the outcome statute this year and towards GAC's work recommencing next summer.
Okay. I just want to remind committee members, we have till January 15th to form our report. Our annual report is due by 1/15/22. So that's Senator White.
I just was going to say that in the community outreach that you're going to be doing, it might surface that there are different outcomes also that should be considered, or different aggregating of the outcomes, like what was proposed before. It should it be, shouldn't it be? So those conversations will also, I would assume, come back to the committee, and it would take legislative action to change the outcomes, but it could come back here for discussion.
Yeah.
Right.
Any other questions, comments, concerns?
Well, I'll just add, so I had put it in my email, the follow-up email that I had sent. So as part of my memo out to folks gathering data for this year's outcomes report, I included a question in the template that asked whether the particular indicator could be disaggregated by race and ethnicity. Not because we wanted them to report the data this year, but because I felt it would be helpful for you all to know which of the current indicators do we actually have data on in terms of race and ethnicity, and which ones could we potentially get data on. So that was the conversation Drew was referencing, where we have about 3 at this point where people are like, yep, we could get that data. There's a number of maybes and unsures. There's a number of cases where the population sample is so small that the data would be suppressed. It just can't get it. So there's a lot of work to be done there, but I'll provide that information to you separate from the report to let you know which of the indicators are potential for disaggregation in the future, just to give you more context.
So
Yes.
So I'm going to just jump in here. And I know that I'm on the schedule later, but as we're talking about indicators and which can be disaggregated and which can't, and how we do that. My thought was that across the state, we have different agencies and different departments gathering data. And they're gathering it in different ways. They're asking questions. This agency might ask a question in one way that this agency doesn't. We had the same issue with law enforcement when they had two different reporting systems, and it's gotten better now with one reporting system. So my thought was that we as a committee should encourage, and I don't know how we do this, some kind of a statewide conversation, not statewide, but government-wide conversation with all the departments and agencies about how they gather that data so that they're gathering it in the same way. They have the same language, they have the same questions, there will be some things that are clearly unique to Agency of Human Services or Agency of Natural Resources. But if we have, I don't know how many agencies and departments we have, but we have a lot. And if they're all gathering data in a different way, and how do we even begin to compare that and make it useful in terms of using the data? So that was what I had here. I had written a little proposal to Senator Collmore, and that's my only concern, is that I think we should, and I don't know how Drew or Susanna feel about that at all, but I just think that we are, right now, public health gathers data. We have just set up a Bureau of Racial Statistics in the criminal justice system that has 800,000 questions in it. It's sorry. Oh, I exaggerate a lot. Sorry, Senator Collmore knows that. But is the data that they're gathering really it was kind of formed by just a very small group of people, and how do we make sure that the data they're gathering is the same that motor vehicles is gathering, and that, so anyway, that's my suggestion here. And I think that is a charge that we as a committee should do and should put in our report and for agencies and departments. And I just jumped in here because we're talking about indicators in which can and which can't. And I think the collection of the data to begin with is really important, and how we collect it.
Absolutely.
So, okay.
So I've got two committee members.
Said. I've had my say. Okay.
Representative Lefebvre.
Thank you. And so I was just agreeing to, I work at the hospital. When I renew my license, they get a whole bunch of data from me. Then when I renew my business, they get a whole bunch of data from me. But none of this stuff even correlates off of anything on, I say nothing, but on here, because I was looking at this, I was like, how would they even fill in these indicators with anything that I give you every single year? So there's many times that people throughout this, the year would be giving information already to obtain a license that they need to continue to do business here. And we're already, asking for information that people are, wondering why we're giving it to them. But if you can say like, hey, this is the exact outcome you're seeing because you're giving us this, sometimes it'll make them hopefully feel like they're giving information for a better reason than just us saying we're just collecting this.
So can I add one thing? I forgot to say that I think part of our direction to the agencies and the departments should be that there needs to be then a decision about not only what data is collected and how it's collected, but what it's to be used for and who has access to it, so that it's very clear to people who are giving the data that the reason for collecting that data is so that we can determine whether we're setting the right policies or not, and who has access to it, because some of that data might be pretty private. Some of it might people might not want to report things if they think that everybody's going to have information or access to their personal information. So I think that the agencies and departments need to come up with a statewide policy of what they're going to collect, how they're going to collect it, how they're going to use it, and who has access to it. I think those were the 4 things, weren't they, Senator Collmore? That, okay, thank you.
So Representative Brumsted and then Representative Dillon.
I just wanted to 150% agree with you. And what we deal with in the House Human Services Committee is the Agency of Education and the Agency of Human Services, and the way they collect data for childcare and preschool and then early ed is worlds apart. And when we ask them about it and we try to tease out similar information so we can compare and look at how we're doing, we get that, well, they have a different computer system than we have. And so I don't know how, so they make it seem like it's so expensive to do that. And that is always a pushback that we hear pretty regularly. And I just, yeah, I bet you can help me out on that. But even if they could just look at their 2 computer systems and in the interim, figure out how do we ask the questions to tease out similar like information, which is exactly what you're saying. And if it takes us to help do that, I am all with, I'll do anything to do that. I mean, I've got a bunch of constituent questions right now at home on my computer that I can't really respond to because I can't get the 2 agencies to help me to put it together.
Representative Dolan.
Yes, so this is extremely helpful, hearing all of these different topics. And I'm somebody who kind of sees lists and stuff, and I feel like we have opened up a lot of different action items for us as a committee. I was hoping to bring us back to looking at the indicators through the equity lens piece. And so I have down too that we need to potentially have feedback on S95 if we want to move that forward, just look at indicators. But for the equity piece, I'm hearing that we could support this initiative of the community profiles with the equity dashboard, which sounds like it's a great fit, and that Justin is looking into what things can be disaggregated going forward. I am wondering if us as a committee, is that something that we want to recommend? Like if there are data points that can be disaggregated into next year, do we go ahead and recommend that that happen? We know that we might change those indicators based on the feedback we get from the community profiles project, but is that setting us up for, this is the path that we're coming down, is disaggregating data, looking at it through a different lens? And is that a decision that needs to come out of this committee?
Well, I think we could certainly take a look at it, much as Justin's predecessor would tell us. Much of it will depend on whether or not the data is available. And there has to be a pretty good reason to ask certain data points. So just because we can disaggregate something, I don't think necessarily means that we should just do that for everything. Because I think there's probably some limitations, both in terms of being able to do it, and as Senator White correctly points out, some of it's proprietary and sort of uncomfortable for people, I think, to just blab to the government, not knowing who's going to see it and who's going to use it. Yeah.
And if you look at even just at the collection of data through the equity lens, some places do self-reported racial identification, and some do the person that's filling out the whatever that person would be, the observer or whoever that is. So is that really comparable at all? And should we decide that there is a best way to do it? Either it's self-reported or non-self-reported, and that's the one of those is the best way to do it. And if that's just impossible, then you have a fallback. But I think that even in disaggregating, we need to figure out how we collect it and what it is we're collecting, and so people feel comfortable reporting that. I know I work for a housing authority, and there's a question on there, your ethnicity and your racial identification. And it's very clear on there that this is not required. It's because people, it's for statistical purposes only, so you can report that you're not discriminating. But people get very nervous if they think, yes, I'm going to identify here that I'm a Black single mother. Oh, well, that cuts you out from housing. I mean, people get nervous about what they're reporting, and I think we need to have a real understanding of who's going to have access to it and how it's going to be used. So.
May I follow up?
Yes.
I would be curious to hear Dustin's thoughts on this of when you hear back from folks of these are the data points that we could disaggregate. If you would be able to provide recommendations of like, okay, for the next year's report, these are the ones that we feel comfortable disaggregating and would give good data. Because I think that's where it is, like it's starting somewhere. Because I realize there's many problems with data, but having some information creates the opportunity to ask more questions and be curious and move forward. I don't know, Justin, if you could share.
Oh, yeah, I'd be happy to do that. And from what I understand, working with Agency of Human Services is that for the ones that they have the data on, they're going to include them regardless of whether we ask or not in this report. So they'll have them on their scorecards, that'll be available. So we could certainly have the question next year about which ones do we actually want to require or ask for that data to be disaggregated. To respond to all the comments about your idea, which I'm 100% in agreement with that idea. And it's something that the Chief Performance Office has been working on. Through all of our federal reporting, we've developed common data standards so that all the data that comes to me to be reported to the Treasury is in the exact same format. So a common list of Vermont towns. Like, it's unbelievable we don't actually have that, but it's just a common list. It's all Burlington City or South Burlington City, like it's all over the place. There's a lot of complications to it. So the systems issue, partially based on siloed funding that occurs. We've got programs that are still running systems based on MS-DOS from the 70s or COBOL systems, right? And so they can't actually easily manipulate the questions that they're being asked. We've got people using Salesforce. We've got most of our data being collected in spreadsheets or SurveyMonkey or Wufoo and all sorts of different forms. A lot of people collecting data all over the place. And then we have some disparities in terms of what the feds are asking for. So, HUD has certain sets of data they're looking for, and they have race dialed in terms of what they want. EPA might have something that's a little bit different than that. So there's no like common federal standard, but we have to provide reports in the way that they want it. So there's all sorts of complications related to it. And the other issue is that in a lot of cases, data is coming in manually entered. And so just as an example, so I have to do the Emergency Rental Assistance Program report. Treasury wants to know unique households served, okay? So if someone works with the SHA or DCF or Reach Up and they get services in both, I have to mash those data sets together and count that person one time. So in one place, it might be Justin Kenny. In another place, it might be Justin X. Kenny. And in one place, the E on my last name might be missing. So I have to figure out across all those data sets that Justin Kenny is the same person using social and date of birth and all that stuff. This is like, and that's just magnified throughout the entire organization. The data is really, really hard. I love the idea. I agree. I think we should have a common data standard. I think it would take some work. And obviously we'd have to include the Agency of Digital Services, the Chief Data Officer in that conversation. I know they've been working on that, master person index, that kind of stuff. But it's going to need something, resources, time, energy.
I was thinking it starting with our disaggregating on race and gender, because that's what we've been focusing on, and not on all that other data that has to be collected as well. I didn't mean to imply that across the state, everybody should be collecting all the data in the same way, but I was thinking just around the equity lens here that we've been talking about race and gender and how we collect that information.
Yeah. Oh, no, I went big because that's what I do.
I know.
Because it's laudable
it would be
to try
good
to
to go
achieve
big.
that for government, to have a common data standard of everything that we collect.
And I agree. I did too, to be fair. I mean, I'm like, oh, if we could have a comment, and I love your example. Thank you for speaking in stories. That always helps me to really understand what it means to collect data. And the thing for me, one of my individual areas is CIS, Children's Integrated Services. And what I really want to understand is if we are helping kids and we can collect the data that shows how much we're giving out and who's getting it.
Mhm.
How do, I want to know that that means by the time they get to kindergarten, because they started getting that when they were an infant, that maybe they don't need an IEP anymore. Maybe they're doing really well in the classroom now. And that will help us to think about legislation overall and appropriation and all of those things. And it's so hard to collect that and to understand that. But thank you for all you're doing to try.
Senator Hinsdale.
Thank you, Mr. Chair. You know, as I think one of the great frustrations for, you know, BIPOC Vermonters, at the very least in the last decade, that I feel like we've been having this conversation is that we will, in some cases, let the perfect or the comprehensive be the enemy of, you know, understanding trends that are alarming and telling people what accountability looks like. So I'm just thinking of a few data points that have recently, you know, kept me up at night. 18 people in Vermont, in Burlington identify as Black homeowners out of the thousands of people who own homes. Young Black men make up 2.5% of the youth population in Chittenden County, but 25% of those charged as youthful offenders. We look at incarceration disparities and policing disparities around the state, and we see alarming trends. What then is our responsibility to score, to give, you know, to sound alarm bells, to say our kind of indicator lights are going off very strongly, and we need accountability in these areas.
Okay. I had a question from Senator White's idea. Like, it's a crazy question, probably. The Agency of Transportation, let's say, collects different information than certainly AHS does in terms of data points. So there's probably going to be some data that just doesn't work. Like, how do you do an equity lens look at culverts and bridges? I don't understand how you could possibly do that.
I wasn't implying that we could.
Oh, okay.
No, I was saying that where in the instances where we do collect data, that we want to try to address the issues that Senator Hinsdale was just talking about, where we know that there are issues and we want to desegregate. We've got a list here of things where that we should maybe be desegregating some of these issues like homeownership. And I mean, I was just going through this list a little bit, but and those are the places that you would start with. And I don't think that that it applies to the collection of all data. It's the ones that, my concern is that the ones that we want to start disaggregating, that we're asking the same questions in the same way so that they can be compared, so that we know why we have a higher rate of young Black men incarcerated. And maybe because we are asking the question differently in the Agency of Education and in AHS and in public safety, that it's hard to get at where those points are that you could intervene and do something, because we're asking the questions differently.
Okay.
That's the way I'm thinking. And I have to tell you, my brain feels like mush today. So I dealt with pensions all day yesterday, and I am a hater of the heat. So I've got mush brain. So if I'm inarticulate, that's why.
No, and I didn't certainly mean to imply that you, by asking that or suggesting that.
Right.
I just
Yeah.
kind of thinking ahead.
Yeah.
I see, I don't know whether that's another question from Senator Hinsdale or whether your hand is still up.
Well, I love my hand up because, you know, I just want to jump in and say, I know we can't do all the data at once and do it perfectly, but the Agency of Transportation has a much higher federal obligation to look at equity for the federal funds that it receives. And where infrastructure is built and maintained is a huge indicator of inequity. Who has their bridges repaired? Who has electric vehicle charging stations? Where we funnel resources for repair and maintenance is a humongous indicator of disrepair and distress in lower income communities and communities that have less political power. So just want to say, transportation is one of the agencies that actually is and should be looking at that more carefully because they have so many federal dollars, and federal dollars, really do follow equity in this current administration and in this moment. And I've been working with the Agency of Natural Resources on that because we are in jeopardy of losing federal dollars for not tracking things through a demographic lens.
Point taken.
Yeah.
Justin?
And I would just add for transportation, you can certainly look at distribution of contractors. What percentage are women or women or minority owned, all of that stuff.
Yeah.
Like who's actually getting these contracts
Yeah,
for the work?
yeah, yeah.
So there's,
Yes, Mayor?
I just want to echo what Senator Hinsdale just said with regard to infrastructure, and also what Justin mentioned with regard to contracting type issues, the human resource piece of transportation issues that was running through my head instantaneously as to, so what part of town gets the roads taken care of faster than other parts of town and stuff like that. If I wanted to assure Representative Dolan that in our report that's due in January, whatever we as a committee decide we want to recommend, we get to recommend. And those decisions don't need to be made today. And the other thing, I wanted to ask Senator White, please, could you run through your four questions one more time?
Well, I think that
Catch all.
it's when we're collecting data, and I'm thinking particularly here, I was thinking particularly about race and gender data, because that's where we were talking, that's what the topic of conversation was what data it is that we collect and how we ask it, what format is it in, and then how we're going to use it, that there should be some kind of policy about how we're going to use it and who has access to it. I mean, I know that, for example, when we did the license plate readers, the automatic license plate readers, it was very clear who was going to have access to that data, so that just anybody couldn't use it.
Thank you.
So, yes, Justin?
Well, just to add back to the example with the emergency rental assistance program, just how that plays out is all the data that I'm collecting from the different departments, programs, agencies that are delivering that funding, because there's multiple. All of those data sets that come to me have to be kept segregated because I can't share the DCF reach-up data with VSHA, right? Or vice versa. So data comes in, it has to be kept, permissions, organized, all that stuff to make sure it doesn't get out. And then the feds have requirements around that data only be used for reporting to them. So while there's a trove of data there about who's getting emergency rental assistance, we've got the race, we've got the ethnicity, we've got all of that, housing, income level, everything. The question is, could I actually use that data to report statewide publicly, disaggregate, right? Not like user level, like participant level. Probably not, because the data is only supposed to be used for federal reporting. So there's like that question there. So many strings.
There are, and at some point, I think we also need to think about who it is where that data is actually gathered and lives, and who has the responsibility for analyzing it and making sure that it gets to the appropriate people. And if that's ADS, I don't know, but if you're talking about larger amounts of data, who will do it? Does every department have to have their own data czar? Or does it go to ADS and they somehow have people who analyze it and get it to the appropriate people? I don't know, but I think those are questions that we need to address. And I personally think this is the committee that can begin to unravel that.
So it might be helpful. I think you said there were 3 indicators that you've managed to kind of isolate. Could you let us know what those 3 are?
Yep.
May I add a comment?
Yes, Representative Dolan.
It sounds like there's maybe two streams of this, because I appreciate hearing this idea and having it focused on the gender, race, equity lens, because I think it is a humongous project that needs to be done and should be done. And like, I think sometimes when we take on things that are huge like that, like it fizzles out or it can't happen. But I think if we look at it through the gender and race piece, and then I think to Senator Hinsdale's, like, having them be in tandem, like looking at the best practices for collecting gender and race data and collecting what we can right now, so that they're happening together. I just would hate to have it be one or the other. Like, we're collecting data that's not so great or doing this, but like, let's do both. Collect what we can. We know it might not be perfect while we're creating standards for what we want, what's ideal.
That makes sense.
Anything else? We've lost Drew, and I guess we've lost Susanna.
So noontime.
Oh, until noon, okay.
Until noon.
Is everybody, by the way, comfortable working through the noon hour? It'll just mean that we potentially could put the key back in our car and head home a little earlier.
We have a break at some point.
Can we take it just?
Oh, yeah, we could do that.
Should we take a little bathroom break or
I guess-
whatever, a sustenance break while Drew and Susanna are at their other meeting?
Yeah,
Senator Colomer,
yeah.
I need to see a man about a horse.
For those that don't realize, that's my code in Senate Gov Ops when I have to go to the men's room. It's an old expression. I'm not exactly sure where it ever came from. I guess I should look that up.
I don't know, but I love it.
A man about a horse. Yes, okay, so it's 11:26. We'll adjourn for
Recess.
recess. 20 minutes, 25 minutes?
Come on.
Okay, let's reconvene then at 11:55.
Oh,
All right.